think I'm going to turn it over to Dr. Carter Edwards and Pastor Stephanie Battle, who are going to talk to us about the power of partnerships. And they have been working to promote health advocacy in faith-based communities. And their approach is very unique in that they really work to build capacity in the community instead of the academic partner coming in and just sharing their resources. It's really how can we partner and really harness that expertise that already exists in the faith-based communities and maximize it so that the faith-based communities can really take the lead in transforming health. And so I'm just really delighted to have them talk with you this evening. I'm just going to provide just a little bit about their titles, and I'm going to let them introduce themselves because they are so dynamic that I could go on about their accolades, but honestly, they can do a much better job. So Dr. Carter Edwards is Assistant Dean for Community Engagement and Professor of Health System Science at Kaiser Permanente. She has been at North UNC in the past. And Stephanie Battle, Pastor Battle, is an associate pastor at the World Tabernacle Church. And I think she'll also put some information, or we'll put some information and a link to her church in case you want additional information about that as we go along. So I'm going to turn it over now to Dr. Carter Edwards and Pastor Battle.
Thank you so much, Lori. I think I'm kicking off this presentation, and I want to say thank you for the invitation to address your group. Congratulations to those who will be receiving awards today. And I'm excited to see how this support, this organization, the work that will come from that, from this. And so thank you for letting me be a part. As you said, Dr. Lori Carter Edwards is a dear friend of mine, but we became friends through a professional partnership. Word Tabernacle Church in Rocky Mount, North Carolina, we partnered with the UNC School of Gillies, Public Health School of Gillies, and we did a project that focused on educating and making sure the African American community was aware of risk factors when it comes to COVID. So COVID awareness. And so we were excited about it, the partnership, but we weren't surprised. And the reason why I say that is because as a church, our whole mission is to make sure that we are empowering people and communities in all areas of life to the glory of God. Those areas we have identified to be our fitness, which is the health arena, our faith, our finances, and our family. And when we are thriving in those areas, then we think that you can be secure about your future. And so as we transition to the next slide, I'm hoping that everyone who is listening will take the message out and be inspired to connect to faith entities as you do this health work. And so at Word Tabernacle Church, as I said, our mission, our goal, our vision is to get out into the community. And this is a slide from our senior pastor, James David Gillier, one of his presentations, as well as, and it was funny as I was reading it, Lori Carter Edwards gave it to me. It sounded like something that he would preach. It sounded like it came from one of his sermons, because he is always talking about the power of the church and how we can influence, and not only how we can, but how we should be influencing and impacting the community. At Word Tabernacle Church, we have a saying that says that everyone in the community doesn't belong to the church, but the church belongs to everyone in the community. And so I hope that as this work goes forward, that these partnerships will increase. And so the next slide talks about why. Why should you be considering faith-based entities in your partnership? And why did UNC Health, and I'm glad they did, reach out to partner with Word Tabernacle Church? The first reason is because when you connect with a faith-based entity, you are connecting with a captive audience. You'll see more about when Dr. Carter Edwards talk about our partnership. You'll see that Word Tabernacle Church, we have a reach of over 3,200 people. So that is on a given Sunday, on a Tuesday when we do Bible study, you have 3,200 people that are tuning in. Then that doesn't even count those who are connected to them. I got tickled the other day when I was talking to a young man who was engaged in our midnight prayer session. And he was like, my grandma had it on the TV, and I was figuring out what was all that noise. So he didn't tune in, but because he was connected to grandma who tuned in, then he was exposed and influenced by the information. 22% of Americans attend church every week. And so we're talking about reaching the nation. We're talking about supporting the nation. You can really have an impact through the community. And I know that our project was specifically focused on the African American community because of the health risk and the increased exposure to COVID that the African American population experienced. So when you talk about even the Black church, 47%, almost half of the African American community attend church every week. And over half of them say that religion is very important. And so the church, faith-based entities, are trusted voices. It's important to them because they trust the church. And so not only will you have a captive audience, but the next slide shows that is a great way to be aware of the community. Now, with our partnership with UNC Health, the Public School of Health, the School of Public Health, I'm sorry, I love the fact that they did not come in and say, this is the research we're doing, and this is what you all need to do. No, because they were partnering with the church, they yielded to us to be the expert in the area of reaching the community. So they didn't say what we were doing. They did say, this is what we want to accomplish. And that's why it was a true partnership, because when it came to research and when it came to statistics and numbers, then we yielded to them. But when it came to being aware of what are the needs of the community, because if nothing else, if the church can't do anything else, and we can do a lot of else's, we can pray and we get prayer requests. So we know what's on the heart of our community. We know what the congregation is in need of. We know those things that worry them or what they feel that they lack. And when you look at, I was looking at some statistics of why people choose the church, and 59% of the people say they look for a church who has community outreach and opportunities to volunteer for the community. And at Word Tabernacle Church, we capitalize on that data because we want people to know that in order for us to fulfill our mandate that Jesus Christ gave us in Matthew 28, to go out into the nations, to go out, therefore, we cannot do church in a silo. We cannot do church within the walls. Now, we do come within the walls to get built up, but we have to go out. And so Word Tabernacle Church, I think we have attracted partnerships as well as people because we speak to those 49% who are looking for social opportunities for the community. How can my family come in and not only be equipped, educated, and empowered spiritually, but we need food on the table. We want to make sure we're healthy. We want to thrive in our finances. How can we do that? And the last thing before I turn it over to my colleague, why the church? It is because we understand our role in affirming the community. So the next slide talks about community affirmation. And what do I mean about affirmation? I mean that helping people simply feel better about themselves. I was just talking to a young lady today, and I said that you may not feel good, or your situation may not be good. It may not even look good to you, but God, the one who is supreme, sovereign of the universe, Genesis 1 says he looked at you and said, you are good. And so if the sovereign one settles it, then you and I can figure out how we can keep going through this. If the sovereign one has already settled that you are good, we can come together and strategically figure out how can you get past this moment. And the church is an avenue to help people emotionally, mentally, and spiritually. And so we understand our mandate as a church, and the partnership allowed us to really speak to our congregation when it came to COVID. because I know I'm not the only one. And I'm just going to be honest, COVID was scary. And it is, until it's gone away, it is kind of scary when we saw the death rate. And so the church voice saying, hey, this is how you can educate yourself. The church saying, this is how you can equip yourself. This is how you can be empowered to keep yourself safe. Then the congregation responded. When you look at the studies of those who identify with religion or attend church, it gives them a sense of optimism and hope, self-esteem, purpose. Because I won't go in. Y'all heard I was a pastor, so I can preach, I can give scripture, but we are built on, our foundation is resilience. In Genesis 50:20, Joseph said to his brothers, what the enemy meant for evil, God turned it around for our good. So we teach and we build our mission on the word of God that says, listen, you can get through this. You can't, all things will work together for your good. And you have help. You don't have to do it yourself. You have higher help. I've learned that through my partnership with my dear friend in the UNC School of Public Health, I've learned that help, yes, it comes from God. And I'm the first one to raise my hand and say, thank you, Jesus. But God also sends help through people and through partnerships. So I am so excited to be able to hopefully inspire you all to continue to connect with the church, not only the church, other religious institutions, other institutions that have a trusted voice that the community will respond to. And so I'm going to turn it over to my colleague, Dr. Lori Carter Edwards, and she's going to talk a little bit more about the project and what we were able to accomplish.
Well, Pastor Stephanie, it's always great to hear you, and just the inspiration. It's like, I wish you were, well, I'm glad you're going to end this, but it's like so powerful, because we sometimes forget as scientists why we do what we do if we don't really connect with communities. What I want to do, we can go to the next slide, is just really, I'll talk more about Word Tabernacle Church and the size in my slide. So we can go on to the next slide. I want to, we can stop each time and I'll talk through each piece of this. I love to go over what the history is of community engagement when I have the opportunity for the first time to meet with people, because us understanding that helps us become better scientists and better community experts who work with us. And so this work started back in the 1800s. And you can find this work in a publication, in a chapter by Wallerstein, Minkler, myself, Avila, and Sanchez in the textbook Health Behavior, with Glanz, Reimer, and Biswanoff as the editors. And we talk about this history from community benefit to action. And initially, the 1800s, this community benefit was a term that came out of the English law, common law concept. And it was articulated in 1891 as a legal decision that defined 4 types of charitable organizations, one of which is the advancement of religion, among others. And as a community benefit, it was an important method of institutionalizing ideals and methods evolved to effectively reach communities and those entities that were meant to aid. In the next stage, in the late 1800s to the 1950s, this is when community organizing started to evolve. Those of you who know about the writings of Saul Alinsky, where the social movement was to create tension or conflict strategies to address social and environmental inequities that impacted health. And this included the development of unions, strikes, and other methods of organization where negotiation for equitable rights just wasn't working. In the next phase of the work that has gone on from community benefit to action in the 1960s to the 1970s is when we started having community participation. And this is a period that acknowledged the participation of the public in efforts. And the World Health Organization's Constitution of 1948 set these principles of the highest possible level of health for all. And this was also the dawning of CBPR, or community-based participatory research, where community members started to be recognized as key to the process of understanding how to improve their own health. The period after this, from the 1970s, late 1970s to the 2010s, I would say, and this is all still in the chapter we talk about, is where community engagement came about. And you see this evolution. And how this is different from community organizing was that it wasn't based on conflict when this started. This was all about empowerment and participation and equity, then conflict strategies for social change as the community organization period, as I mentioned. And the 1978 declaration of the Alma Ata Conference called for the urgent need for effective national and international action to develop and implement primary health care throughout the world, and particularly in developing countries, in a spirit of technical cooperation. And this period was to support national and international commitment to primary health care and to channel increased technical and financial support of it. This is also the period where the Centers for Disease Control and Prevention and the National Institutes of Health, the Patient-Centered Outcomes Research Institute, and the Agency for Healthcare Research Quality and other federal agencies started looking at transdisciplinary partnerships, team science, community engaged research to encourage and support true systems change with all stakeholders engaged in the process. In this last section, I consider this right now, and this is my interpretation of where we're at from the late 2010s to the present. I call this the community action phase. And this is where I think we're now, the changes in administration, the civic unrest, what we just saw occurring in Buffalo, and the pandemic itself has led us to going back to community organizing while conducting community engagement efforts. And we've evolved to both top-down and bottom-up efforts with a greater push towards accountability, which we're now hearing more about, community context, and institutional infrastructural changes. And so as we look at this evolution, it's important for us to think about this as we're working with our community partners. We're now in the period, to me, of community organizing and community engagement. We cannot do this work without addressing the tension that's occurring, that hopefully after we get through this tension, we can see an improvement in equity by changing some of these institutional barriers. Let's go to the next slide, and let me tell you a little bit about our project. This project that we did was truly engaged, and I want to acknowledge my partner and friend who invited us to even present, and Lori Crosby as well, is Rohit Ramaswamy, who also was at UNC at the time. We both left at the same time, him to go to Cincinnati and me to come to Los Angeles. We worked together with Pastor Battle, Pastor Gillier, and our two teams to develop effective, sustainable strategies for promoting rapid, remote risk communication strategies for novel coronavirus, or COVID-19, and future public health emergencies by leveraging the power of social connections within rural Black faith communities. And you heard Pastor Stephanie talk about these power of social connections and spiritual connections. And so what we did is we used basically a soft system science approach combined with community engagement. And we've been presenting on this nationally as well, because we're taking implementation science and adding the community engagement component to really demonstrate this equitable partnership. And I will say it was truly equitable. The Pastor Stephanie and the Word Tabernacle Church, even though it was a small budget of $100,000, they got the majority of the budget. We may have been only $1,000 more getting the majority of the budget. But a reason I want to share that with you is they were doing the most of the work. They were on the ground trying to actually do this work. We basically acknowledged that. And that was really important to the Pastor Gillier as well. In our aims, and I'll basically quickly go through this and then to the next, to the last slide, and then listen to what you have to say. Thank you for bringing that up. Is our first aim was for us to identify these drivers of trust and social cohesion in rural Black faith communities. And I want to give my partner Rohit mad kudos, because he's the one who introduced soft system science to us and this co-designed approach. We basically used a variety of techniques to do this work. We involved, we basically used the risk communication and community engagement WHO guidelines, the RCCE. We used systems mapping. We used the REAIM framework. reach effectiveness, adoption, implementation, and maintenance. For those of you who are not familiar with those terms, but this is an implementation science framework. We used human-centered design, where we tried to empathize with listening to Pastor Stephanie and the rest of the Word Tabernacle team to define and ideate. And then we tried to prototype, and we haven't tested completely, but we definitely got to the prototype level of doing this work. And so we used a variety of different methodologies. What was beautiful about this soft systems approach is that what Pastor Stephanie was mentioning in terms of the religious component, we made sure that that was part of the social cohesion component when we then worked with them to develop the risk communication strategies. So this was really critical, that we're really listening to our community partners, even if we weren't familiar with the religious components. Even if I'm religious, that doesn't mean that everybody on the team is, or that I would be. So even if you're not, how do you listen to our partners? Our second piece was to design and test the strategies, which the church did the lion's share of the work of testing these strategies with their partners. And then we definitely got to the point of identifying the biggest strategies, but we still have yet to disseminate. The reason that what's on the side here is just to let you know that this was our announcement flyer that we handed out. This was deliberately done. We had language, and we made sure that this language was written in a way that the church was interested in. So they basically wrote this component to make sure that those who were members of the church would actually read it in the manner that they needed to read it. It is also purposeful that we have listed our community partners first as the project team, and our community partners are down and below as the second group of figures. And then they basically wanted to have a potential impact, so they actually put that in the slide as well, and the figure, I mean, in the sheet as well. Last slide. And in this last one, just to give you some comments about this church, we took this from practice to research. This is a mantra I'm working towards. And no, you don't necessarily always have funds available, but we have to start really working on capacity building first if we're truly interested in sustainable, long-term community engaged partnerships. And we have to figure out how to work with our institutions to provide those seed dollars to actually help us get to that space. And so the partnership that we had was based on my partnership with Pastor Gillier from a capacity building exercise that then led to not just this research study, but others. And so you look at how large the church is. They had 89% that were in 9 rural counties, 22% did not have internet. So we had to think about how to work with those who didn't have internet. They have a large staff, and how do we share that information? They work from a district level, so everybody's touched with their 4 district leaders. They have one of the state-of-the-art media centers that is even used by local businesses to develop commercials. That's how technologically advanced they are. And we did mass mailing and digital messaging as some of our ways to do this work. I'll stop here, and Pastor Stephanie, last word, so that we can get into question and answer real quick.
Yeah, no, we can definitely move to question and answer. And I just want to, again, hey, Rohit, I had to say that because I hadn't seen or talked to Rohit in so long. And that's the thing, when as we were working on this, we were building relationships, and relationships are very important when trying to do any source of work. And so I just want to inspire people to think outside the block. What I mean by that is we all have a block of people, we have our sphere of influence where we are limited. We limit ourselves we limit our reach. And so think outside the block. I say that there are 380,000 churches in America. There is almost, even in Rocky Mount, we have about 55,000, a population of 55,000, but we have upwards of 300 churches or more in Rocky Mount. So that equates to almost a church on every block. So you have a partner right around if we diversify our means and efforts and we think outside the block. So I want to open it up for question and answer about the work that we continue to do that was birthed out of this, or just anything that you may have for myself or Dr. Lori.
So first, before we open it up to questions, I just want to thank both of you so much. Sometimes you just need some inspiration in the middle of a tough week, and you need to think about possibilities and what can happen and how you can, really harness what the resilience of the community towards promoting health. So thank you for bringing and taking your time and sharing that with us and bringing that to us this afternoon. And I will open it up now for questions, but I see some claps and other things from the audience. Would anyone like to either chat in a question or come off mute and ask a question? If not, I will ask one, but I'm trying to give other people an opportunity. I have lots of questions. Okay. No one else? Okay. I will ask the first
Monica
question.
has a question.
Oh, Monica has a question. Great. Okay, Monica, great.
Yeah, my question is, what have been some of the biggest challenges to doing the work, and how have you overcome those?
Is it okay to start, Pastor Stephanie? You okay?
Yes, go ahead.
Time is always a big challenge. So, we were basically on a 1-year project timeline. It was very intense. And of course, all of our work wasn't compensated. Dr. Ramaswamy can attest to that as well as Pastor Stephanie. So the time to actually do this, we had to make changes to how we were going to do this work, because we were hoping that we were going to meet with the team. So we had to change it to make it remote. So how do we actually address those who were not going there? At the time we started this, people were not going to the church. The church was not open. So if they didn't have technological opportunities, we had to figure out how we were going to get a rich picture to them, get that feedback, whether we mailed it, how are we going to actually do that? So we had to change some of the technical procedures, and that took time. When we designed, and I'll mention one other piece, when we were working on the soft systems piece, there was an issue of trust. So while we assumed that what we were doing was really laying out some clear details to make the soft system science or the rich picture instructional approach easy for people to understand, to use, they still weren't trusting that process, because they weren't sure whether they were going to give us what we needed. And we were trying to say that it doesn't matter. A rich picture can look whatever way you want. That still wasn't flying with the team. It was not necessarily a lack of trust in us. It was a lack of feeling that they were confident that they would give us what we were interested in, which there's no way we could allay those concerns. And even Pastor Stephanie could attest to that. So what we did is we changed the process. We had one person from each of the different groups for which we were getting rich pictures from. They then did a rich picture, the one that was comfortable with doing so. And then the Word Tabernacle Church group talked with the other people who were asked to develop rich pictures to see what they would add to the picture or modify to the one picture that someone did. So we actually had to change how we actually did this work. And so I think part of this is, how can you be adaptable while you're doing scientific work in this way, in this manner, and still keep to the rigor of the work while providing work that gives you outcomes? Pastor Stephanie, do you want to chime in at all with that?
I would just add, this was a challenge, but also an opportunity for growth, because science and religion can be two different worlds. I'd laugh at one of the meetings when Rohit had to just like break some terms down, like, what are you saying, bro? What do you mean by that? And Lori and Dr. Monica Taylor, everybody else, they knew exactly. And I'm thinking, like, it seems like I'm supposed to know what he's talking about, but I have no idea. But that partnership, it was opportunities for me to grow in areas. It was educational, but because those are two different worlds, before you present this to the community, we had to come together and, simplify it for us so that we can present it. We saw ourselves as like the mediator between the research and the community, and we wanted to make sure we were communicating properly. So that it sounds like a simple challenge, but I grew so much from that. And also when I was presenting stuff to the research team, I was very mindful of that as well, so they could understand, what we were trying to say, so that we could, our partnership could be stronger.
Thank you both so much. Teresa, I think you had a question as well.
Yes, but I think Pastor Stephanie just answered my question. Thank you so much, both Dr. Lori and Pastor Stephanie, for sharing this presentation with us. I'm very much involved in community engagement, but also very much involved in the church. And one of the things that we've experienced in the past that my question was around any challenges that you may have had with working with the community and residents outside of your church membership. Because at times, sometimes, even with what we try to do in our church, you get pushback. So were there certain strategies and or challenges or things that we may encounter as we move forward through this type of work?
Pastor Stephanie, you want to start?
Yeah, and I want to say, every partnership is not a match made in heaven. And I say that to say, just because it's a church on the corner don't mean you partner with them. But I think that Word Tabernacle Church, we're 17 years old, and from day one, our mandate or mission was the proclamation and the demonstration of the word. And so from day one, it was important for us to get into the community. And so we had developed that relationship already with outside organizations. Like I said, our motto was everybody in the community doesn't belong to the church, but the church belongs to everybody in the community. So we showed up with our Word Tabernacle Church gear at basketball games when the two rival teams were playing, and we didn't have anybody on the team, but we were there because the community was there. Right. And so we showed up when they had the block parties because the community was there. We have learned as a church that we have to get into the community so that even though they're not a member of your congregation, they trust your voice. And so while you are looking for people to partner with, make sure that they have that heart, because we wouldn't dare want it to taint the work that UNC wanted to do. And vice versa. And so you're going to have to seek out, all churches don't have that community mindset. I mean, and that's no knock to any organization at all, but I say seek out. And then a community, the word community is relative. It speaks to who you have influence over. Start there and watch it grow. We have had invitations to do grants as a result of our partnership with UNC Health. Now people are like, hey, can you all? So we started with them and it is growing. People, and so I want to say, start where you can start and then watch it grow. But just make sure your partner is representative of what you want to accomplish.
My
Thank
only
you
other,
so
add,
much.
because I know
Oh,
there are other questions here,
Yes.
is the leadership. You have to have support, and we all know that. Sister Adams, is that the leadership has to support this. And so if you get pastors together who all are on the same page with the leadership, and you want to work with a network of pastors who actually believe in that need leadership, and they then work together in that community to work towards a common goal, that is how you get partnerships as well, to do this. But you gotta have pastoral leadership.
Thank you.
Not just from Pastor Stephanie, but from Pastor Gillier, our senior pastor.
Yes.
Right. So we have 2 questions left and 2 minutes. So we're going to try this and see how it works. But we have a question from Jackie and a question from Dina. So Jackie, go. We'll try to get it done in 1 minute and then give Dina 1 minute.
That's okay. Let Dina have it. Go ahead, Dina.
You sure? Thank you, Jackie.
No, you know what, I lowered my hand because the answer, my
Oh,
question was
okay.
answered, but thank you so much. So go ahead, Jackie.
Okay. My question is, what type of outreach? Give me an example of what you was actually trying to get the community to do. Give me exactly a project. Was you trying to bring some health information, like health fairs? What? Like, give me an example.
So the whole goal was to create risk communication strategies. So how do we tell information about COVID-19 to individuals so that they can either A, go get tested or go be vaccinated, or practice all the mitigating factors? Because we know there'd been so much misinformation or lack of information that was reaching rural communities. But how we go about in developing these risk communication strategies in a rural population meant we needed to know how best to, what mechanism was necessary. So the science behind this was working with the church to figure out the best mechanisms that can hopefully be testable and implementable beyond Word Tabernacle Church and in other communities on how do you reach people who don't have internet and basically live in a community where the towers are limited and they don't really have the best phone connection. How do you work with elders who may not be able to where their only communication may be the radio or whatever? How can you work with those who basically do have the options and have internet, and how they can share that information with others? So that's what we were doing, was trying to develop risk communication strategies for COVID-19 testing, increased testing and vaccination, and understanding of the information on testing on COVID-19 to mitigate, the burden that was occurring in rural communities. Did that answer your question, Jacqueline?
Yeah, I didn't know if it was just on COVID. Okay, can you give me a number of their success?
Like how many people you reached, or right?
So basically, it was basically almost the church community, all of them. So the 3,300 basically heard all the messaging. So we had delivery channels, we had messaging. So some of the messaging came from the pastors. They had like coffee shop hours. We have stuff on the ministry, so Bible studies. They also had materials. We had a variety of different strategies that were used by the church to share the messaging. And because they had worked with, remember I was showing you the district leaders? The district leaders are the connectors to every member of the church. So they have district leaders and they have leaders of the district leaders. And because this church had such a powerful infrastructure, they were able to make sure that everyone was reached in whatever capacity to get at least one of those methods of channels of messaging delivery, if that makes sense, Jacqueline.
Okay.
Thank you so much.
Did that answer your question?
Kind of. Okay, well, because of time, we need to move on, but Jackie, maybe you can chat in
Please,
your question.
I'll leave you my email in the chat.
Yeah, Lori and
we didn't do the
Pastor
details.
Stephanie. Yeah.
We didn't go into details here in the interest of time, but we have plenty of slide decks that we can share with you on the work that we've done to give you more about what the success and who they reached. We can't say that there's any behavior change. We didn't get that far. Okay, thanks.
Okay, and thank you. And Dr. Lori and Pastor Stephanie, thank you again so much. We truly appreciate your time, your energy, and you're inspiring to us in our community. I think people are already thinking about ways they can partner, and they want to know the impact that you had so that we can know and the potential impact here. Rohit Ramaswamy is on, and he put in the chat that people could talk with him too. He's now in Cincinnati, and he was also involved in the project. So I'll just mention that. All right. Thank you again.